get started, can you please state your name and spell it?
Yep, it's Amy Rowan, AMYROWAN.
And can you tell me where you work and your title?
I work at Tri-County Health Network, who's based in Telluride, and my title is Care Coordination Supervisor.
Can you tell me what the job duties for the Care Coordination Supervisor would be?
Yes, so I oversee quite a few different programs with Tri-County Health Network. One of them being Medicaid care coordination, and we get funding through Rocky Mountain Health Plans to follow up on any Medicaid member our region. So we cover Montrose, Ouray, and San Miguel County for care coordination. So any Medicaid member that has been in the hospital, we do follow-up calls upon discharge. And then we also work with referrals from either the community member or the clinics themselves will send us referrals if they have patients who are having difficulty making their appointments or picking up prescriptions, those types of things. One of the other programs that we do is the Accountable Health Communities Model Project, which is AHCM for short. That's also through Rocky Mountain Health Plans. And in that project, we work with clinics in Gunnison, Delta, Montrose, and San Miguel County to provide the social determinants of health screens in the clinics. So we have clinic staff that are asking patients if they've had some ER visits, if they have any insecurities around food, transportation, utility assistance, personal safety, or isolation. If they screen positive from that project with 2 or more ER visits in a 12-month period and having 1 or more of those social determinants, they are also referred to care coordination. And then we follow up with them and help them get the resources that they need. So those are the 2 main projects that we're working on for under care coordination.
About how many are they called clients then that you serve? Do you serve?
So in Montrose County, there's about 12,000 community members that are on Medicaid. In Delta County, there's about 9,000 that are on Medicaid. San Miguel and Ouray County, I'm not sure on the numbers. I think there's about 1,200 that are on Medicaid in those 2 counties.
So I'm not real familiar. Is that a large percentage of people in that area?
So to give you a reference, in Montrose County, there's about 44,000 residents in Montrose County, and about 12,000 of those are on Medicaid. So we have about 70% of the population, it's almost 20% of the population that are on Medicaid. That's just Montrose County.
And is that a lot? Like, I don't know, compare that to some other counties in Colorado.
I think across the board, you're probably looking, it's probably evenly distributed to about 20% of the population are on Medicaid. The 22 counties that Rocky Mountain Health Plans covers for care coordination, there's about 100,000 residents that are on Medicaid.
How has COVID affected the work that you do?
So it's really interesting. From the beginning of the social distancing back in around about March 13th when we started, we had a lot of our Medicaid members were reaching out to us. And when we were doing our follow-up calls from either a hospital discharge or from a referral, our phone calls that typically last anywhere from 5 to 10 minutes were lasting 20 to 30 minutes with the community members that we were following up on, because they had so many questions about the isolation, so many questions around how they were going to get food, around how they were going to get to their medical appointments. And so at that point, we were spending a lot more time on the phone than we had been beforehand, which we thought was great, being able to put some of our community members at ease that they would still be able to get food, they would still be able to get transportation. We have been working on, had already been working on updating our resource list that we give out to the medical clinics throughout the region around food, transportation, utility assistance, housing information, isolation, and personal safety. And so we were able to get those updated pretty quickly with all of the new COVID restrictions, with the congregate meal sites closing, with food banks opening up extra days, with new food delivery programs that opened up, with new grant funding through some of our local agencies who received some funding to help with rental assistance or utility assistance. So we were able to get those updated pretty quickly and start getting those out. What we've noticed though in the past couple weeks is our homeless population that we had good contact with in the beginning when the social distancing started, kind of dropped off, and we had a hard time finding some of those folks because they were worried about getting arrested, worried about being harassed by local law enforcement. So those that we were in good contact with and had good rapport with kind of dropped off there for a while, and we were really worried about where they went and if they were getting the resources that they needed, like food.
What do you think caused their fear all of a sudden?
I think their fear with the MATA, who was one of our agencies here in Montrose that was providing resources for the homeless, like showers and laundry assistance and some food, that closing down. And then law enforcement, so they were, a lot of the homeless were camping in some wooded areas, and they were being asked to leave those wooded areas in fear of them being arrested. We think that they actually went out to BLM land and were just hiding out to not get arrested, to not get in trouble with law enforcement. So they weren't coming into town to get some of those local services that they were getting before, like the lunches and the food from the food bank, or even showers. You know, a lot of our homeless are homeless because our housing, we have such a housing shortage, and they have jobs, they have income, they have money, they just don't have a place to live. So they were utilizing some of the services for showers and laundry so they could be clean to work. In the meantime, we have actually, so they're starting to reach back out again. Last week, we were able to make contact with some of the ones that we had contact with previously. And we do have a new shower program that Housing Resources of Western Colorado is implemented. So somebody can go in and get a shower in one of the local motels, stay the night, get cleaned up. So we have a one-night shower voucher that they can use once a week. So now that, you know, that's being available, and I think our folks are starting to reach out again. But it was really, really interesting how we had such great contact, and then it's kind of dropped off, but now it's starting to pick back up again. But we also saw that with our Medicaid follow-ups with our folks in the beginning. We were having those 30-minute conversations, and then there for about 2 weeks, we had a hard time even getting a hold of anybody, and we really noticed that people weren't following up with their medical appointments. They weren't utilizing the ER. We even had an instance where a husband had called one of our other care coordinators and mentioned that his wife had just had a baby. And so on our mind, we're like, oh, do you need to get health insurance? You know, congratulations. And like, no, she truly had just had the baby at home, but they were so scared to go to the hospital that they didn't reach out. So our recommendation was to call the ambulance, of course, but we've seen that with so many, generation-wise, it doesn't matter age, it doesn't matter sex. People are scared, and so they're not reaching out and getting the medical attention that they need that are not COVID related. We've seen a decrease in in people reaching out for strokes, people reaching out if they've had a heart attack, which leads to, probably worse symptoms down the road. But I think fear in actually going to get medical attention and being around people is keeping people from getting that medical attention. It's really interesting.
How has it been in your counties, the number of cases?
So in Montrose County, as of Sunday, we were up to 101, I believe. I think we've had 11 deaths. And so I think once they started reporting the deaths is when we really saw a decline in people seeking medical attention. Ouray, I think, is still at 2. San Miguel, I think, I'm not even sure where San Miguel's at, 7 maybe. And I'm not sure where Delta's at as of today. But it's interesting throughout the different counties that we serve, the response has been different with each county. So San Miguel, right off the bat, started the social distancing even before the governor put in the orders. They started about that first week of March. Ouray County really didn't do a whole lot until probably 3 weeks into the social distancing. Montrose started when the governor started, and Delta was about 2 weeks after the governor started. So it's interesting to see how the different, and then Gunnison, who had cases, weeks before we started the social distancing, they really started the lockdown early.
Mm-hmm.
So it's interesting to see, working in the different counties, the responses of the different counties, the responses of the community members in the different counties. San Miguel County community members, they were on board, started the distancing. Montrose, a little bit behind. I think even now, Montrose still isn't doing the distancing they probably should be doing. And Ouray, they've locked down. They're taking care of their own. They're not asking for help. We're reaching out with some of our other programs, but that with that being a retirement community, they have a lot of support, inner community support, and they haven't reached out for other agency support.
Do you happen to know if the illnesses were tied to care facilities or to factories or to jails or prisons?
We have had an outbreak in 2 of our nursing home facilities, and an outbreak was educated. It was educated to us that an outbreak means that there's 2 or more cases, and which is the case in a couple of the facilities. They had 2 cases, so it was called an outbreak. A local restaurant had an outbreak last week, so they are closed down. Another business in Montrose had an outbreak as well. But we're seeing a higher increase in just community members. We're seeing a high increase in our Hispanic population with being COVID positive. And so it's spread out through the community that we have a young, I think a toddler that's been positive on up to, people in their 90s and everybody in between. So it's hard to say where people have been, where they got in contact with it, because it's so sporadic and so spread out. It's hard to pinpoint the different locations.
I see. You think of the word outbreak, I think of, lots of people, not 2. But it is so contagious that you probably want to stop it right at 2.
Exactly. Yeah.
Can you speak to the health disparities and social determinants of health that this event is affecting in your communities?
Yeah, we've actually been doing a lot of talk around, we've heard so many media people say that this is the great equalizer and that we're all in this together, and that everybody is, seeing it and feeling it the same, which is so completely untrue. This is
Baloney.
equalizer. You know, and people with higher economic statuses, you know, aren't affected by the loss of jobs because they have more admin jobs. So, you know, they're not losing their income. We're seeing a high disparity with our low income and our homeless population being, I don't want to say swept under the rug, but I'm going to say swept under the rug, because on a lot of the conversations that we've had with, you know, in March, for the full month of March, I had 90 hours of meetings that were on top of my normal regular work. So we've had a lot of meetings around the populations that have been affected. And when you bring up people living in poverty and when you bring up homeless, you know, the focus for a while was on seniors and taking care of seniors, and anybody that was under the age of 60, you didn't get service. We're also seeing disparities in who's getting tested. So, you know, the Hispanic population aren't being tested. Is it because of the lack of publications being translated so they aren't getting the word out? Or is it because they're not understanding what the COVID and the crisis is? And so we've had a lot of conversations around making sure that all of our documentation, the county has their documentation translated into Spanish, and we're getting the word out to those populations. We're getting the word out to those low-income families that don't have internet, that can't look at Facebook or, you know, the news on a daily basis. So disparity-wise, I think the education through the communities, there's a lack of education equally across the communities. And then for the resources, you know, those that, you know, have lost their jobs, you know, it's been like jumping through hoops to get income, to get any financial assistance. And so disparities and oppression, we're seeing a lot of it. And I think one good thing that's going to come out of this is that I think more people's minds will be open. I hope. I might have my rose-colored glasses on and hoping that we can come out of this and looking to see all of the disparities that we have throughout our counties. I don't know, I'm hoping that it'll bring our communities closer together. But from some things I saw this weekend, I don't know if that's going to happen.
What did you see this weekend?
You know, it was interesting. We went to Home Depot twice this weekend. So we went once on Saturday, later in the afternoon. It was about closer to noon. And the people that were in there on Saturday, you could tell were some that were of that maybe lower economic status, lower education status. They weren't wearing gloves. There was no social distancing. People were running into each other. People were walking in front of each other, reaching in front of each other. It was so interesting to watch the dynamics Saturday afternoon. Sunday morning we went, and we're like, we're going to go early. So we went about 8 o'clock Sunday morning, and the people that were in there Sunday morning were dressed a little bit nicer. They all had masks on. I would say 98% of the people that were in there Sunday morning had masks on. People were distanced. People were polite. It was just such an interesting look at how Saturday afternoon was compared to Sunday morning. And I attribute a lot of that to the education. I attribute that to some of the politics that we're seeing around this is a hoax. It was really interesting. So that part of it kind of makes me lose a little bit of, like the humanity is not quite there yet.
Yeah.
Compared to Sunday morning when it was.
Say that again?
Compared to Sunday morning when it was, and people were showing that respect. And so, you see the protesting that's going on. You're seeing, large groups of people that are already coming together. And I think we're going to be in this for a long time if people don't have that compassion and don't have that respect that this is a real crisis.
Yeah, until it touches somebody in their family, and then it's too late because it just, rips through families, people in close contact with each other.
I will say, though, the one good thing that has come out of this is a lot of the agencies that do provide care, a lot of the agencies that provide service to all groups of people have really come together and really do now understand what each other does. And that's where I think, moving forward, I think we're going to be better off because we do have a better understanding of what law enforcement does, of what Department of Human Services does, of what transportation does, of what the fire department does. And so I think moving forward, just with all the conversations and meetings and communication we've had, if this happens again and we have to social distance in September, I think we're better prepared as a society, as communities, to be able to handle it. And I think the agencies that provide the care are better equipped with the understanding of what all the services are in their community.
So you're seeing greater interconnectedness and collaboration, or simply you think communication and referral?
I think interconnectedness and collaboration.
Oh.
Sure. I am on a call with one of the county commissioners in Montrose does a call, and they were doing it 3 days a week, then 2 days a week, and now we're down to 1 day a week. And on the last call, there were probably 40 different agencies that provide a variety of service throughout the county on the call, given a report, asking questions about what other agencies are doing, how do they refer their clients that are having, utility assistance issues or domestic violence issues. So I think that piece of it, we're going to have great success in having better connected agencies throughout the communities, for sure.
That's good. I worry that the financial impact of this is going to linger for many years to come. I imagine somebody losing their job and not being able to pay their rent, and then they still owe the rent, and then they get evicted, and now where do they come up with a deposit and more rent when they still owe rent? And burden to carry forward.
Yeah, I mean, you figure if you lose, 2 months of income and your rent is $1,000, and plus your utilities, plus a car payment, I mean, it's going to take a long time for people to be able to recover. And I was saying this from day one when they were putting in all these food programs and money right off the bat when people were still kind of working. And I'm like, looking at how we're going to help people 6 months from now. We need to be looking how we're going to be helping people a year from now, because, being out of work or getting sick and not being able to go to work for a couple months, this is really going to put people behind. It took a little while for that long-term, we need to practice this long-term. We need to find long-term solutions. It took them a while to get out of that acute crisis to look at this as more of a chronic issue, be needing to find sustainability for. But I think that there's a lot of agencies that are reaching out and applying for grants and have some really good processes in place to help people budget, to help people look at, their finances as a whole and how can they be sustainable and how can they get back on their feet. So there's going to be help out there.
Can you speak to what impact this might have on the healthcare system?
It'll be interesting to see where this takes us on the healthcare system. I think because over the past, let's say 2 months, by the time we get to the end of May, it'll be 2 months or mid-May. I think those that didn't seek medical care, those that probably had some mini strokes, those that might have had heart attack, those that probably didn't have diabetes in control in the beginning who aren't seeking medical care. I think those we're going to see an increase in cases in heart attacks, strokes, diabetes issues, some of those chronic conditions that need to be managed on a monthly basis by a physician that hasn't been managed. I think we're going to see an increase in ER visits on those that haven't had that medical care. I could be wrong, but I think that's coming. I also think that under people that are going to be in contact with COVID, until we have more testing, until we have immunizations against it, we're going to be seeing cases for a long time. And I think we're going to have rises and falls throughout the year, depending on, weather, depending on group socials, how things open up. I think our cases are going to get higher. I hope that doesn't happen, but I think the hospitals have done a good job in preparing for an influx of COVID patients that need to be in isolation along with the other patients. I haven't seen a lot of the other patients, but I do think that is coming.
Mm-hmm.
Medicaid care coordination just in our outreach to folks that, haven't made their follow-up appointments that were in the hospital. And so, not doing those follow-ups, not getting the prescriptions that were prescribed, not getting, if they don't have the transportation to get to their appointments, even if they are going to go, those chronic conditions don't go away.
They just get worse.
Yeah.
Do you know if telehealth is something that is utilized?
I have seen, so Tri-County Health Network has a behavioral health telehealth program, and we've seen a huge increase in the number of cases that we're providing to. But I also know that a lot of the medical clinics, especially in Montrose County, have moved to telehealth, and they are starting to pick up on the appointments, and people are getting used to it. The Center for Mental Health has had great success with their telehealth appointments, with Medicaid loosening up their rulings so the therapist can actually have phone calls. They can have groups over Zooms and those types of things. That has increased. And I was on a call the other day where they think that, they're hoping that this will continue, that Medicaid will continue to let telehealth be, because more people are starting to get some of the behavioral health services that they weren't getting before because they can do it over the phone.
Yeah, there's not stigma attached around going into a facility for that.
Yep. Yeah, so, and same with the doctors being able to see their patients, via phone. I think that it's not going to, I don't think telehealth is going to go away. I think this is going to just be a new way for some patients that have a hard time getting out. It's a new way for them to be able to get their continued medical care.
Yeah, that is a huge positive.
Mm-hmm.
So many of us take for granted transportation and getting to where we need to go, and just hop in the car, and it's not accessible to everyone.
Yeah. Well, especially now, I have to give All Points Transit and Montrose credit. They're continuing transportation. They did shut down the public bus, but they're using their Telluride, so the door-to-door service, and people can use their bus passes to the Telluride service, so they're still able to get to their appointments. And so that's been huge in Montrose and Delta. They've continued, and same with Sunshine Rides has continued to take people to their medical appointments. But it's those that need to get out and go to the store, pick up their prescriptions. Those are some of the barriers. To get to medical appointments, that's still happening but people don't want to go.
Yeah. Yeah. Are you working from home?
Yes. So my position at Tri-County Health Network, I'm a remote worker anyway. So I worked from home anyway. So I'm actually up in the Telluride office today because we have 2 new staff members starting today. So I came up to do some training. But for me, working from home didn't change anything in my work routine, but I could see a difference in some of our other staff members that did work in the office that were remote workers. They felt very isolated and were having a hard time kind of getting a work flow. And so I was telling them, you've got to get up, you have to get dressed, you have to keep your normal morning routine. And some of them, it took them a little bit to actually get into that. But one of the things that we started is a water cooler chat. So it's a Zoom meeting that's a 15-minute meeting where anybody that's on our team can get on and chat about anything. Because you think about how much chatting happens in the workplace next to people. And so some of our team members were feeling pretty isolated. So we did our water cooler chat for about 15 minutes every day, and we're continuing that through May. And it really changed the atmosphere. It really helped some of our team members get to work.
Do you think it improved productivity?
Yeah. It was a little bit of a check-in as a supervisor too, if people are checking in at 4, but I really think for morale, it increased our morale. After that first week of the distancing and working from home, we could start seeing some anxiety in some of our staff members. And so just opening it up to have what are you having for dinner? What's your son doing? How's your kids? Really did help. Yeah. So our last one was supposed to be last Thursday. And so we continued on. And so we're going through May, but it is challenging. One of our other staff members was having a lot of neck and shoulder issues just because her setup wasn't ergonomically correct. And so she's leaning over. So, just working with staff to make sure your computer is tall. And, I went over to a couple staff members' houses to make sure their computers were set up that aren't, tech savvy. And so that made a difference.
Huge. We had the same thing here with our internal staff, having a hard time to transition to working from home, or in Georgia's case, not stopping working. Right. She just, it lingers into the night, and she's up doing emails at 10 o'clock at night, and then back at it first thing in the morning.
Well, and so many of our staff members do one-on-one, community work. We have the community health worker program who screens for diabetes and cholesterol, so that's one-on-one face-to-face work. So they haven't been able to do their jobs. So they're doing tasks that aren't normally in their wheelhouse, but to stay employed and keep that income coming in. We do a Skippy program, which is a dental hygiene program in the schools. And so our dental hygienist hasn't been able to do her work, so they're working on other projects and programs too. So it's finding other work that could be done for staff too, so they don't get furloughed. So they, we haven't had to lay anybody off or decrease any hours because the work that we do, and we cover such a wide area, we were able to put in other programs. Like in Telluride, for instance, we implemented a home delivery program for lunches. And so some of the staff members switched to working with the volunteers and making calls and things like that. So, it's coming up with other ideas for staff to do, but other programs too, to keep things sustainable. Yeah.
We've had to do the same thing. Has this impacted you personally?
I didn't think it really had, because I've done care coordination and the work that I've done for so many years. That piece of it didn't affect me, but the story about Home Depot this weekend, that really affected me. I'm like, oh, come on, guys. Come on, people.
Was this the first time you'd been out in a while?
I've been to the grocery store, but other than that, I haven't had the need to go anywhere. I, went and picked up a few papers from a few clients, but didn't meet with them face to face. But as for actually getting out, going to the grocery store, it's been pretty low key. But yeah, this weekend I was like, told my husband, I'm like, this is giving me an anxiety. Like being around other people that don't care. I think that's what's giving me the most anxiety is, you know, you're keeping me from being able to go out because you're not being safe.
Yeah, it's everywhere down here.
Oh, that piece of it, I was just like, come on, we're working so hard in the jobs that we do to keep people safe and to get people resources. And all you're doing is creating it to where we could be at a point where we're locked at home again.
Yeah.
You won't wear a stinking mask. Yeah. So I didn't think it really had been affecting me.
Here.
Yeah. This weekend, I was just like, man.
And we're opening up even more. It just scares the bejesus out of me.
Mm-hmm.
It's not even, you know, going to last a couple months, and we're we're just inviting this in. People act like it's been so hard, and you know, staying home or staying out of the grocery store, not going out to dinner. Oh, please.
Yeah. 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 Well, and the whole, I was reading an article, somebody that is suing because making them wear a mask is a civil rights issue. And, you know, this virus affects everybody. It doesn't discriminate. And we've been saying for years, no shirt, no shoes, no service.
Yeah. Why can't we add masks?
Why can't we add the mask to it? It is for all. It doesn't matter your color, your class. It's for all. And so I was kind of chuckling at that. I'm like, no shirt, no shoes, no mask, no service. How hard is that?
Yeah. What about the rights of other people to live healthy lives? Yeah. For you, that you don't have to wear one. What about my sick grandma?
Yeah. What about, Mr. Jones who has, who tries his hardest to keep his diabetes under control, or, somebody that has cancer, that they didn't ask for.
Yeah.
You're making it very difficult for them to live their lives as well.
It's hard.
Yeah.
I'm so glad when we're on the other end of this. 5 years from now, what do you think people are going to remember? Are we going to retain this? Are we going to make some lasting change? Or are we going to just go right back into it's all about me again?
Yeah, I really hope through this, though, we can, create some changes to where if we do come up with another pandemic, we've got things in place. Agencies have more of an idea of how to serve those in a crisis. And I really hope that more agencies understand that, those that are living low income, those that are living in poverty, often, don't choose to be there. They work, they try, those that are on Social Security, that's their income.
Yeah.
When you're at 70 and you live on $1,000 a month, you really have no other choice. So I hope that brings more enlightenment to the agencies that serve.
Do you think even some agencies weren't aware of that?
Oh, I definitely know. I don't think it. I know it. Yeah. But they're more aware now, which has been a good thing.
Yeah.
Yeah.
Is there anything else you want to talk about, Amy?
I don't think so. Yeah. Thanks for thinking of me.
Yeah. Thank you so much for your time and